with us in studio, Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital. Late night last night, huh? How about that comeback?
It was a late night, but it was worth it. I enjoyed every minute of it.
Yeah, boy. And we got him up 1-0. Tomorrow it's an early game, 6 o'clock.
Yeah.
1590 WAKR. Okay, you wanted to get into a new study on head and football.
Yeah,
injuries.
in our world, this is what everybody's talking about. And Monday, it was released from Annals of Neurology and picked up in everything, Washington Post and USA Today, and a lot of evaluation of this study. Another study on tackle football. This was at what age starting to play. And the big question that I'm asked all the time is, should kids start tackle at an earlier age? Should we extend flag to another age and have kids play later? It doesn't answer every question, but this is probably another piece of the puzzle. And so one of the things you and I have been doing in the last 10, 15, 20 years is kind of putting the puzzle together as the pieces come out. And this study is another piece in the puzzle. It is another Boston University study. Several have come from there. This is the place where they study the brains post-mortem, where they, after these people die with more significant brain injury, they look at the brain. And the 246 people they looked at were all people who had their brain studied, which means they were all people that had really significant symptoms, really bad, dementia and other things in this 246. But remember, 1.2 million kids play football every year between the ages of 6 and 12. So this, I think, is going to get has a real chance of getting misinterpreted again, and that's why I appreciate you having me on, is they did not say that all these kids playing between 6 and 12 were going to have this brain injury at 20, 25, 30, at a young age and other things. They did not say that at all. The 246 they looked at were the worst of the worst in this area. So if you went to the people in my brother's clinic, infectious disease, with the worst 300 things they had, all the other million, so 1.2 million kids who play. Most all of these played professional football or at least 4 years of college football. Then they had problems later in life. Then they looked at this 250 or so and said, how many started football early and how many started after age 12? And the ones that started early got their symptoms early. And so they're saying that, hey, early symptoms if you started playing before age 12. And the final conclusion by Ann McKee and the people at Boston University was their recommendation: don't play tackle football till after 14, when the brain is matured a little bit further, where the connections have been made in the brain, because during the ages of 6 through 12, that's when there's a lot of maturation going on in the brain.
Joe, let me ask you this, and I know you can give me this answer. You and I have talked about baseball maturity. My son has played baseball, and we've talked about throwing curveballs at an early age, the strain that it puts on the tendons, the ligaments, and the arm and such. If we're playing tackle football at a young age, when the bones are still maturing and the tendons and the ligaments are still maturing, away from the head injuries, for example, what about tackle football to these youngsters in those regards?
Tackle football, we see more traumatic injuries. Again, I talk about it here a lot. The most vulnerable area is the growing part, exactly as you said, the maturing part of the bone, the joint, the knee, the ankle, is the growth area, the growth plate. Growth plates get injured quite a bit. And in our clinic, where we have orthopedics next door and 9 orthopedists and 9 sports medicine people side by side, we see people getting off and heading to orthopedics with casts on from here on through the rest of the summer. And so definitely during football, there's going to be a lot of traumatic injury to these growing areas. But luckily, the majority of those heal really well. That's the other good part about treating kids, is those bony injuries to the joints and the growth plates and the bones heal very well. The thing that makes it a little bit more concerning about the brain is, does it heal all the way? Are there times we pass a point of that? And that's what makes this such a hot question area.
I know in areas of California, they are already saying no tackle football before the age of 14. That passed, about 6 to 8 months ago. Do you see more and more of this coming?
I see a lot of people wrestling with this, and I know it because people call me and ask if there's any studies that shine a light on this. And this is one now that you could point to and say, yes, it does, and that's why it has some importance. Again, it's looking at a very small selection bias of a small population, but nevertheless, it does say that starting at an earlier age And so I've talked to you before about trying to make flag more compelling, perhaps, so the kids' first exposure to the sport of football might be flag up until that, filling the void of 12 or 14 or whatever age. So, yes, I think people are going to be looking at trying to do that. I was asking my kids yesterday, and my son, who played youth football, do you think that flag is fun enough? Is it enough fun that lots of kids, the same number that play youth football, 1.2 million in this country still last year? There was a drop-off, but it wasn't a dramatic amount. There's still a lot of kids in this country that play that sport. So we'll be watching it really closely. You know that. But I think something like this, maybe next year, maybe the year after, there will be less of tackle football in that younger age range.
Joe, when we talk about football in general, again, whether it be youth, high school, college, or pros, one of the significant plays in football is the kickoff. Mm-hmm. Everyone has looked forward to the kickoff since the time the game began. NFL is looking at maybe taking the kickoff away from the game for safety purposes. I kind of agree with that, to be honest. You see a lot of injuries. The kick most times goes in and out of the end zone anyways. But when you've got 11 guys charging, 11 trying to block, and they're all trying to dismantle the one guy returning the ball, I think that sets yourself up for injuries. From a medical standpoint, how do you look at this possible change in football?
Absolutely no question about it. The number one play, by not even a close margin, is the kickoff for injuries overall and head injuries particularly. So there's no doubt about it. And the best rules change that occurred at the NFL level in the last 6-8 years as they've tried to come up with rules changes was the one to move the kickoff up so that 80% of kickoffs essentially go into the end zone. Best rule change by far, biggest effect on reducing numbers of concussions. So going all the way to eliminating it, I think, makes really good sense. At the younger levels, it's been eliminated. We haven't taken the step yet. High school, college, pro, I hope when you're talking about it that way, is remember, pro, only that really tip of the iceberg. The bigger numbers are in those other levels. I am totally with you on that one, with the kickoff being such a significantly dangerous play. I'm very much in favor of looking at eliminating it.
And seeing so many games through my life of doing play-by-play, high school and the college levels for the most part, tons of injuries on that particular. The punt return to a degree, but it's more on those kickoffs, and they call them kamikaze units going down, and that's what it ends up being. I mean, they're throwing their bodies in there into those situations.
It is. We'll monitor that one closely, too, but a lot of talk about that this year, too, and I think that's coming in the next 2 to 3 years. I really do think that's coming, too.
All right, Joe. Thanks for joining us. We appreciate it.
Thanks, Ray. Have a great week.
You too. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, joins us Wednesdays here on the Ray Horner Morning Show at 1590 WAKR.